Hi everyone, this is a quick update just to let you know how we're doing. I've been to the hospital again today. This is the 24th of January to see the haematologist, Dr. Manson, who actually is the head of the blood transfusion department. Now this was very good, but the aim of today was to see, as this is bloodless surgery on my aorta valve, open heart operation, we needed to formulate a package of what could be used and couldn't be used in a variety of circumstances throughout the operation, and before and after, how we can help prepare for the operation. So she started off taking all sorts of information about myself, family life, any haemophilia in the family or anything like that, you know, so that any risks, she would know about everything, prior operations, if any, etc. And then we started on what we would be doing. So she wants to build my blood up to its maximum, and the content as well, the volume of that. To do that, she's putting me on iron sulfate, which will help stimulate my blood production. So it'll give me a little bit more volume, but it's the quality of the blood that is more interesting as well. And then 3 weeks before my operation, she'll start me on a course of erythropoietin, or EPO, and that will generate red blood cells within me, and they're the ones that carry the oxygen, so I may be able to go a bit faster for a little while. But what this means is, when I actually do go into surgery, because of the high quality of my blood, when blood is lost, that's remaining will then be of great quality to be able to stimulate me to quickly be able to recover the volumes of blood. And also she mentioned that the surgeon isn't particularly interested or concerned, is more of the word, about losing a lot of blood, because a human body can actually lose a lot of blood, go down to a level of 4 before they start getting concerned about that. And in certain instances, she said that surgeons don't mind losing a certain amount of blood, because that then puts less pressure upon the system. It's just the need for volume. So they use saline solution to keep the veins open, save them collapsing and things like that. So that was interesting. So that's my pre-op package: iron and erythropoietin, EPO. During the operation, she asked me would I accept the cell salvage machine that sucks up any blood in the vicinity of the wound, takes it through a circuit, cleans it, washes it, extracts the red blood cells and puts them back into you, because that's the ones that are of the key issue. Because it's in a circuit, we as Jehovah's Witnesses view that as part of our own circulatory system, and we're in a position to be able to accept it if our conscience allows that. So we discussed that. We also discussed the heart-lung machine, which is a bypass machine. So again, it runs in a circuit, so that's acceptable to Jehovah's Witnesses if they choose to. It's a conscience matter. Also, she mentioned after the surgery, so that's during the surgery, they're able to give me all these things. Also, it's interesting as well, they can give me a high dosage of erythropoietin, EPO, during the operation, which will stimulate production immediately as soon as we start losing blood, stop losing blood, etc. So that's many things that they can do to help. So it's really a gold standard of surgery that we're getting here, because number one, the doctors are far more careful with the way that they cut into the patient, knowing that they haven't got a couple of pints that they can just tap into if something goes wrong. That isn't an option here. So we get a gold standard of surgery. We also get the best medicine. Erythropoietin is a very expensive drug, and they do not give it to just anyone. you have to meet a certain criteria, and Jehovah's Witnesses meet that criteria because it's bloodless surgery that we go for. So that's great. When the operation is over, again we'll be on a high supplement of iron, and again using this EPO to stimulate my blood back to its normal level. Now she said that 3 weeks I'll be feeling a lot better. Maybe on the 4th week, for some unknown reason, you maybe start to feel fatigued slightly, but that's natural. But certainly from after that week you'll start being up and up. And I said to her, can I climb mountains in my 3rd month off work? Because of the work I do, you're not allowed to lift certain weights, so I'll have 3 months at least off work. So within that 3rd month I hope to go climbing, so will I have enough energy to do that? And she said I certainly will. 8 weeks, be no problem after that. So that's something to look forward to. So that's the blood side all done and dusted. Because of the work that the HLC, that's the Hospital Liaison Committee, do. Now the Hospital Liaison Committee is set up because we as Jehovah's Witnesses do not accept blood transfusions. They have been working for many, many years with doctors, going into hospitals, giving little seminars, showing what's out there to be able to be used instead of a blood transfusion. We do not refuse all medical care, we just will not accept medical care that involves blood and the 4 components of blood. So other than that, we're open to everything. We want to live, we love life, and we certainly want to use that life to the best in serving our God Jehovah. So that's where the position we're at. I'm now set up, we've got a game plan for my operation, and she is going to see the surgeon to see if we can set some sort of date, because she needs to know an end date, because I need to start the erythropoietin 3 weeks beforehand, so we need a date. So that will maybe come very shortly. So that's the stage that we're at. I'm very happy. I'm kind of like wanting it done, wanting it over, but at least I know things are progressing. I've seen the surgeon, I've seen the haematologist, we've got a game plan for what is going to happen and take place. So now hopefully we'll have a date very, very shortly. So thanks for watching. Hopefully we'll have far more videos, and I'll be able to catalogue my day-to-day, how I'm feeling, etc. But for now, thank you very much for watching. Goodbye.